Hello, my name is Ryan Smart, and today I'm going to discuss the nature of dementia. Today we will discuss what dementia is, who is susceptible to dementia, the demographic of which dementia targets, and the current research information available about treatments and cures for the different variants of dementia. Now, to begin, what is dementia? Dementia is an umbrella term used to assist in the identification of dementia and normal memory-related issues. Dementia describes a collection of symptoms which can be attributed to disorders affecting the brain, and it is not one specific disease, hence it being an umbrella term. Dementia is classified as a mental illness, and a mental illness is something that impacts a person's ability to live their day-to-day life in a negative way. It can affect someone's thinking, their behavior, and the ability to perform everyday tasks, enough that it can interfere with a person's normal social or working life. So, now that we've got a definition, who has it? Currently, according to the Australian Bureau of Statistics, there are approximately 413,000 Australians living with dementia, 55% of which are women and 45% of which are men, and the number is expected to increase by well over 100,000 in the coming years, meaning a whopping 500,000 people or more will have dementia by the year 2025, and that's just in Australia. Worldwide, there are approximately 40 million people who fit under the umbrella term dementia. Currently, there are around 244 people each day joining our population with dementia. The number of new dementia-related cases is expected to increase to over 300 in 2025 and over 600 by 2056. Dementia is the second leading cause of death in Australians, with the first being coronary heart disease. Additionally, some studies suggest that these deaths are possible to prevent with prevention programs, which, if they had been implemented correctly, could save more than $120 billion by 2056. Additionally, if the research currently being conducted would be able to reduce dementia-related deaths by a mere 5%. The ABS claims that the cost of government subsidies in aged care facilities would decrease due to the fact that more than 50% of the residents in these facilities have dementia. In fact, around 85,000 out of 164,000 have dementia, as per an ACFI assessment on the 30th of June 2011. So statistically, the likelihood of that increasing is quite high. So, now that we have an idea of the numbers, let's talk about the age demographic. Most people with dementia are older, but it is important to remember that not all older people get dementia. It is not a normal part of aging, because its effects are adverse and severely negatively impact people. Dementia can happen to anybody, but it is more common after the age of 65 years. People in their 40s and 50s or even their 30s can also develop dementia, though this is referred to as early onset dementia, and while it is incredibly tragic, it's far less common. Statistically, less than 30% of dementia patients are diagnosed with early onset dementia, that is, people under the age of 65. And some famous people who had or still currently have dementia include Ronald Reagan, Rita Hayworth, Rosa Parks, Robin Williams, and Estelle Getty. So, now we know the age graphic, so let's open up that umbrella and poke around inside to define some of the terms underneath. The most common types of dementia are Alzheimer's disease, vascular dementia, Parkinson's disease, dementia with Lewy bodies, frontal temporal lobar degeneration, or FTLD, Huntington's disease, alcohol-related dementia, or Korsakoff syndrome, and Creutzfeldt-Jakob disease. Now, a handful of you may have heard of some of these, and some of you may not, but they all result in the creation of symptoms that lead to dementia. Mind you, these are all the leading causes of dementia, so it's important to keep in mind that there are also many other different terms and types out there, which is kind of worrying. But to show you just how complex and different these types of dementia can be, I will break down two of them and how they affect the brain. The more commonly known Alzheimer's disease and temporal lobar degeneration, or FTLD. Named after the doctor who discovered it in 1906, Alzheimer's disease most prominently known symptom is that of how it erodes memory function and a person's ability to cope over time. But do we know why? Well, if your dentist was also a neurosurgeon, him telling you to floss and brush your brain each day would make sense the older you got. Why? Because of these babies. Plaques and tangles that reside in the brain slowly eroding at neural tissue over time, and even residing on dead cell tissue. This is why the Alzheimer's brain has fewer nerve cells and synapses than a healthy one. Furthermore, it's also why people with Alzheimer's develop issues with memory, behavior, and function, because their neurons are unable to fire and their brain has slowly lost its adaptability due to old age, also referred to as lowered neuroplasticity. They begin to lose functionality in certain regions of the brain. Most importantly, however, is where the brain first starts showing symptoms, which usually occurs 10 years after the plaques and tangles have begun destroying neurons. Alzheimer's symptoms first start in the hippocampus, which is linked heavily to long-term memory, emotions, and other facets of enjoyment and memory. Then symptoms start to spread, and eventually the brain will continue losing functionality over time. Most people are usually diagnosed when the symptoms have become mild, and it's slightly more obvious that they have been affected. People experience greater memory loss and other cognitive difficulties. Problems can include wandering and getting lost, trouble handling money and paying bills, constantly repeating questions, and taking longer to complete normal daily tasks, as well as personality changes and differing behaviors. Now, I'll break down FTD. Frontotemporal degeneration is a disease process that results in progressive damage to the temporal and/or frontal lobes of the brain. It causes a group of brain disorders that share many clinical features. FTD is also commonly referred to as frontotemporal dementia, frontotemporal lobar degeneration, or Pick's disease. FTD is distinct from other forms of dementia in two important ways. The hallmark of FTD is a gradual, progressive decline in behavior and/or language, with memory usually relatively preserved. As the disease progresses, it becomes increasingly difficult for people to plan or organize activities, behave appropriately in social or work settings, interact with others, and care for oneself, thus resulting in increased dependency on their caregivers. The onset of FTD often occurs in a person's 50s and 60s, but has been seen in as early as 21 and as late as 80 years old. Roughly 60% of the cases occur in people who are 45 to 64 years old. Thus, FTD can affect work and family in a way dementia in older patients does not. While there are currently no treatments to slow or stop the progression of the disease, FTD research is expanding, producing greater understanding of the disorders. We anticipate that this knowledge will result in a growing number of potential therapeutics entering clinical testing within the next few years. Although specific symptoms may vary from patient to patient, FTD is marked by an inevitable deterioration in functioning. The length of progression varies from 2 to over 20 years, with a mean course of 7 to 13 years from the onset of symptoms, which is quite a long time to be alive with this kind of disease. FTD itself is not life-threatening. It does, however, predispose patients to serious complications such as pneumonia, infection, or injury from a fall. In fact, the most common cause of death for people who have FTD is pneumonia. Now, are there any treatments for these illnesses? Yes, there are, but unfortunately at this time, most are only temporary, and for many aspects of dementia-related illnesses, they will remain untreatable. Alzheimer's treatment, for example, only slows the effects of the illness, not reversing or preventing them. Examples of this are cholinesterase inhibitors, Aricept, Exelon, and Retazine, Residine, and Memantine, or Namenda, to treat the cognitive symptoms, memory loss, confusion, and problems with thinking and reasoning of Alzheimer's disease. There is also a medication that combines one of the cholinesterase inhibitors, donepezil, with memantine called Namzaric. As Alzheimer's progresses, brain cells die and connections among the cells are lost, causing cognitive symptoms to worsen. While current medications cannot stop the damage Alzheimer causes to brain cells, they may help lessen or stabilize symptoms for a limited time by affecting certain chemicals involved in carrying messages among the brain's nerve cells. Doctors sometimes prescribe both types of medication together. However, people in the medical field are taking steps in stride in order to find preventative measures against these illnesses. So much so that there was a breakthrough very recently. There was an article about it on the 11th of December, which is yesterday, the Huntington disease, which is genetically passed down from parent to child. And after a trial of drug tests, The results have suggested a positive outcome, and a research paper further explaining all of these results will be released next year. The information held in these results is said to be revolutionary and useful for creating the next step in immunization against dementia, though a true cure may not be available for some time. The report indicates that it may be the biggest breakthrough for dementia-related illnesses in the last 50 years. And with that, we now have a basic overview of what dementia is, both as an umbrella term, its symptoms, who it affects, and the current methods of treatment that are undergoing trial. I hope this has bettered your understanding of what dementia is, and I hope you have a fantastic day.